inform you that there are now 462 Victorians who have lost their life due to this global pandemic. That's an increase of 24 since yesterday's report. Of course, our thoughts and best wishes, our sympathies and deepest condolences are with the families of each of those 24 Victorians. They are comprised of one female in their 60s, 3 males in their 70s, 3 females and 7 males in their 80s, 6 females and 4 males in their 90s. 21 of those 24 fatalities are linked to aged care outbreaks, and again we send our deepest sympathies and condolences to each of those families. There are 578 Victorians in hospital. 39 of those are receiving intensive care and 16 of those 39 are on a ventilator. A total of 2,132,679 test results have been received since the beginning of the pandemic. That's 13,480 since yesterday, and I'll come back to testing in just a moment. There are 4,116 cases with an unknown origin, 55 that have been closed out and added to that total since yesterday. 434 health workers who are active cases. Those numbers have stabilised and are coming down, and that is very, very pleasing. Of course, we don't want to see any of our dedicated health workers, regardless of setting, regardless of the discipline they work in, contracting this virus. And I think the announcements yesterday were very important, both from a research point of view and an understanding of the challenge, but also the many steps that we're taking are exactly the right ones to take. We'll keep listening to that workforce though and keep engaging with them directly, and we take this opportunity again to thank them for their care and compassion, for their commitment, for the amazing job that they are doing, and no doubt they will continue to do that work. That's just the sort of people that they are, and we're very, very grateful to each of them. There are some 3,488 active cases across Victoria, so as the Chief Health Officer had made it clear, those numbers would tail off, and they are, which is good news. In terms of active cases, Metro Regional, 203 active cases in regional Victoria, 66 in Greater Geelong, 23 in Greater Bendigo, and I think my latest update is 6 active cases in Ballarat. We'll double check and confirm all of those numbers for you in the Chief Health Officer release later today. But in aggregate terms, some 203, that is a much lower number than it was even just a couple of weeks ago, and that's very pleasing. Numbers are low in regional Victoria, and we want to keep them that way, and that's why we're so grateful to everyone in regional Victoria for following the rules, doing the right thing, and of course coming forward and getting tested. On testing, these numbers will still be the tail of the weekend when we know, of course, the weather was not good at all. It does make some sense that as you have less symptoms in the community, you therefore have less people who are symptomatic coming forward and getting tested. Lockdown, I think, also makes it perhaps somewhat harder for people to go and get tested, but I would make a couple of points. Firstly, having as many people as possible, that is to say everyone who's got symptoms, even the mildest symptoms, coming forward, getting tested is critically important in our strategy. It's critically important not only to driving case numbers down, but it's critically important to us opening up and making sure that businesses can survive, making sure that people can have their job back, that there can be new job opportunities across the Victorian economy. All of that activity is predicated on us having, without putting a number on it, because the numbers will move around, but all of that activity, all of those rule changes are predicated on us having what the experts believe is a credible and accurate picture of how much virus is out there in the Victorian community. So I just say again to every single Victorian, regardless of your circumstance, regardless of your setting, your postcode, if you've got symptoms, even the mildest of symptoms, as soon as those symptoms start, as soon as there's an onset of those symptoms, please come forward and get tested. It's a massive, a powerful thing that you can do to support everyone across the community in our strategy and our fight against this wildly infectious virus. I can report that the average time to result, so the average time it takes between when you take the test and when you get your result, is now just under 1 day. Some of those results are being achieved much quicker than that. I had someone telephone me yesterday. One of Kath's friends, she and her housemate had gone and got tested fairly early in the morning. They had their results by mid afternoon the same day. So the lab workers are doing an amazing job and of course total volumes of people are down a bit, so on that basis they can process a bit quicker, but there's every chance you get your result back on the same day, if not within a 24-hour period. It is so important that the people come forward and get tested, and not after you've been symptomatic for 2 or 3 days. That can be when you're most infectious. As soon as you get the onset of symptoms, please come forward, please get tested. We're going to look over these next few days at whether there's anything we can do differently to make the testing experience even easier, to potentially make it even more, convenient, if you like, for people to go and get a test. But anyone who's symptomatic, please come forward and get tested. That's our request of you. I know we're asking a lot. We have been in these recent months, but this is a really important thing that you can do, not just for your safety, for your health and the health of those who you love, but for the safety of the entire state and us getting to the other side of this second wave and being able to open up. That's what we all want, but we've got to have sufficient certainty and confidence that we're getting an accurate and a big enough snapshot of how much virus is out there in the Victorian community. Just very quickly, a couple of other updates as I usually provide to you. There are 50 active cases in aged care, in disability facility settings, 50 of those. In terms of aged care, the total outbreaks that are active is 1,487, and we have 50 active cases in disability facility settings, 1,487 active cases in aged care settings, and in terms of outbreaks, our total active outbreaks in aged care is 121. The combined efforts of our government, the Commonwealth Government and all agencies, both in aged care but also in these often very complex disability facility settings, is working well. It is very challenging, but we've seen some significant stability come to those environments. I haven't got a shifts worked number for you today, but it is a massive effort, and we're so grateful to all of those hospital nurses and others who have gone in to an environment they wouldn't traditionally expect to be working in order to do that really important work. Just before I speak to a couple of special guests that we've got today and intro them, I just wanted to make a couple of comments in relation to the ability for the Chief Health Officer to continue to make rules, albeit very different rules than the ones we are currently living under, as our strategy continues to be successful. It's very important beyond the 13th of September that, of course, we have the ability to make rules so that we can open up, so that we can make sure businesses survive, make sure that we get people back on their feet, and then begin a massive program of jobs and skills and trying to put the strength back into the Victorian economy and into communities that we are so well known for. I can report to you that we're having very productive discussions with the crossbench, and I'm very hopeful that we will get an outcome that allows the Chief Health Officer to continue to do his important work, allows all of the team to continue to make decisions based on science and evidence that are proportionate to the challenges we face, that will underpin us opening up. I think we've just got to think for a moment. Imagine the plight of a business that were to open up in just a few weeks' time, and then we don't have the power to keep people who've got this virus at home. So that becomes a kind of an honesty policy. Even a handful of those people perhaps make the wrong choice, and this gets away from us again. Imagine the impact on that business. Imagine the impact on staff. Imagine the impact across the board. There are some basics here, and the ability with legal authority to make sure that someone who is positive with this virus stays at home and stays safe away from other people. You simply can't have an opening up strategy unless you've got the ability to make those sorts of rules. Not the stage 4 hard lockdown rules. We're working as hard as we can to get past those, to get well and truly beyond those. But the key to opening up is not going from stage 4 to stage 0, where there are no rules. There has to be a framework, and it does cover simple things like risky industries, dangerous industries from a COVID-19 point of view, having compulsory safety plans. Things like people who are positive having to stay at home for that 14-day period. We're having very productive discussions, as we always do, productive discussions with the crossbench and we're very confident that we'll be able to get an outcome that both protects public health, but just as importantly, allows us to plan for the future with some certainty, not for a week or a month, but for many months. The ability to plan an opening up, a proper plan of jobs and recovery, that's only possible if you've got the certainty of being able to put rules in place, common sense rules, rules that are proportionate, not just for a very short period of time, but for a longer period of time. That's what we're driving at here. That's what we want to try and achieve. And I'm very grateful for the positive way in which we've been engaging with the crossbench. I thank them, and we'll continue to talk through these issues with them, just as we do on every single issue. This is, again, I want to make the point to every single Victorian, we will need rules for many months to come, but they will be about making sure that we can recover, making sure that we can rebuild, making sure that we can open up and find that COVID normal. Then, of course, thanks to the amazing work of scientists, researchers, clinicians across the world, but very well led right here in our state, hopefully then we have a vaccine as soon as we can, other treatments that will allow us to not so much be in a COVID normal, but in something that is much closer to normal, the sort of space that we all want to get to. Now, in general terms, I just again thank all of those Victorians. It's a growing number. It is the vast majority who are doing the right thing. I know that we're asking a lot of you. We're so grateful to you and proud of you for the job you're doing. We see these numbers continue to fall. I have said a couple of times that today, of course, marks the halfway mark from industry closures. So it was about 3 weeks ago today, or midnight tonight, to have these numbers down from the 700s down to a weekly trend now that sees them well and truly into the 100s. That is a mighty effort, and there's a big team working very hard, but the biggest team and the hardest work is going on in every household, in every community, in every part of our state. And I'm very grateful to everyone who is doing the right thing. It is making a big difference, and it is driving these numbers down. And once we get them down further, we'll be able, with rules, the lightest touch possible, only what's necessary and only for so long as it is necessary, we'll be able to begin that challenging task, but one that I'm very hopeful about and very positive about, the task of rebuilding, the task of focusing exclusively on jobs and skills and strength. That's exactly where we're going to get to, but you can't get there with no rules at all. I wish that were the case, but of course I think everyone understands that's just not possible. Now, I'm joined today by Professor Julian Elliott from Monash University and Professor Wei Hong Tam from the Walter and Eliza Hall Institute. Both are leading teams of clinicians, researchers who are doing quite amazing work, not just in Victoria and Australia's fight against this wildly infectious virus, but the world's work. They are part of a global fight. They're making breakthroughs that are so important, not just for us here, but for everybody. And that is the story in so many ways of, I think, Australia's strongest medical research community, one that works very collaboratively with their colleagues around the world and certainly in other states. But we are, I think, rightly proud of the research, the quality of the science that comes out of our city and state, and we've got two shining examples of the importance of that work and the leading nature of that work, the cutting edge nature of that work. We have provided just under $15 million in funding very recently, over these last 6 months, towards some of the work that Julian and Wei are doing and other work that's going on in other medical research institutes. So I thought it was appropriate today just to hear a little bit more from them about the work they're doing and how it's unlocking some of the mysteries of this virus, how it might be very, very important on the other side of this in terms of treatment and trying to contain the spread of this virus. It is very, very important, as well as protocols on how to deal with such a wildly infectious virus. I think Julian's fine if I was to ask Professor Tam from the Walter and Eliza Hall Institute to speak first, and then we'll hear from Julian, and then of course we're happy to take any questions that you have. Professor Tam.
Good morning. So we've been leading an antibody consortium to develop antibody-based therapies for the treatment and prevention of COVID-19. And what we're interested in is actually developing antibodies that actually can block the entry of the virus into the cells and therefore stop virus infection. So what our consortium has been doing is to actually seek through millions and billions of antibodies to look for the most potent ones that can actually target virus spike protein that's on the surface of the virus cells. And virus spike protein is the exact protein on the virus that are actually used to enter human cells. And so if you can use antibodies to block those virus spike proteins, you can actually block virus entry, and you can also then block virus infection. And so we're really keen because antibody-based therapies have already been used for the treatment of cancers and multiple immune disorders, and we think that it would be an amazing antibody-based tool for the treatment and prevention of COVID-19. And we're particularly grateful for the Premier and Minister Mikakos for funding this work to accelerate the progress of what we've been doing in the scientific world to develop potent and effective antibody-based therapies against COVID-19. Thank you.
Thank you, Premier. I think we can all agree that during this pandemic, we've been living through a time of great uncertainty. Even early in the pandemic, it was quite clear that Australian clinicians were being bombarded with claim and counterclaim, conflicting guidance about the best treatments or the best care for people with COVID-19. So with the very rapid and proactive support of the Victorian government, and then subsequently Australian government in Potter Foundation, Equity Trustees and the Lord Mayor's Charitable Foundation, in early March we established the National COVID-19 Clinical Evidence Task Force. The task force is a consortium of 30 national peak clinical groups who've come together to speak with one voice, to develop evidence-based, consistent and unified guidelines so that Australia's frontline clinicians can have very clear guidance about the best possible treatment and care for COVID-19, so they can provide the best they can for people who are suffering from this disease. We work around the clock, every night, searching all around the world for any COVID-19 related research. We evaluate and summarise that, and then feed that through to our expert clinical guideline panels, which consist of over 200 of Australia's leading clinical experts who are then updating the guidelines every week. This is a model called Living Evidence, which has been led from here in Melbourne. And over the last 5 years, the Victorian Government and others have supported a number of innovations, including new technologies, which enables us now to keep up with this incredible flow of new research. The guidelines cover all aspects of the clinical care of people with COVID-19, right from someone with mild disease being cared for at home by their GP, through to hospital and intensive care, including both adults, children and pregnant women. So no matter what the swirling social media storm of the day or the latest news, Australian clinicians will continue to get access to very clear, consistent, unified guidelines about the best treatment and care for people with COVID-19. And I think Victorians and Australians can be reassured that we really have a world-class system here that's underpinning the care that's being provided in primary care and in hospitals around the country. So I just want to finish by thanking all of the hundreds of clinicians, very busy clinicians, who are working day by day providing care, who give up their time to provide guidance for their fellow clinicians around Australia. Thank you.
Happy to take any questions you have. Or not.
Speak to the experts.
Yeah, absolutely, you can. You can do that you can do that now. You can do that at the end. Whatever you think is best for you.
Let's do it now.
We'll do it now. All right. I'll go and take a seat down there, and you can.
Professor Tan, perhaps go first. It just again, I know you already explained, but just in layman's terms, just if you could explain what the antibody treatment is designed to do.
So what the antibody treatment is designed to do is to actually have antibodies that target the spike protein. and because the spike protein is what the virus uses to enter cells. And so what the virus does is has a lock and key mechanism between spike protein and human cells. So if you can actually bind an antibody that blocks spike from doing the interaction with human cells, you actually stop virus infection. And so what we're trying to do is to amass all that kind of scientific evidence that we know very well about the virus now, and to actually develop two potent combination of antibodies that can actually gum up the function of spike, stop it from entering cells in laboratory settings, which we've already identified. And by actually combining two different types of antibodies, you can also stop the escape of viral mutations as well. So what you're developing really are antibodies that you can deliver to patients that you know are already going to be safe, they're going to be potent, they're going to stop virus entry, stop virus infection, and they probably, hopefully, will work against all the circulating variants that you have in the community.
And
so
they being
would you
used.
give that to people when they've tested, after they've tested positive?
Antibody-based therapies can be used as both prevention and treatment. And so what we're hoping to do is to provide it prior to someone who has an infection. And so in particular in settings of elderly populations who can't mount a good immune response to vaccine, prior to outbreak, you can actually deliver an antibody-based therapy to protect that population that wouldn't be able to mount an immune response. We're also looking as a treatment option, and this would be delivering those antibody-based therapies very early stages of disease.
How soon can you see that happening?
So right now, the most important thing that's in our minds is to make this as safe and as effective as possible to stop virus entry. And so we've done all the work now in the laboratory settings, and we're going through with our collaborators at the Doherty Institute, Burnett Institute, Kirby, and also CSIRO, but also our industry partners, CSL and Affinity Bio. These are the best group of infectious diseases researchers and also the best antibody therapeutic developers. And what we're doing now is we've gone through those billions of antibodies. We've selected the most potent ones that have worked in laboratory settings, and we're very much looking forward to development of a safe and potent therapy that we can move into clinical trials.
Can you give a time frame, though, about when that will be used on people?
Currently now we don't have a time frame because our paramount importance now is to make it as safe and as effective, and also something that will work in humans. And so for us, that work is important, that work needs to be done, and that work needs time. So currently now, no timeline.
So months or years, though, just for the layperson who has no idea about
For the
it?
layperson, we're very hopeful. We are working as hard as we can. I've never seen groups of people across the road within Victoria, within Australia, mobilizing scientifically in such an amazing and passionate way. And, it's incredibly fast work. If we're very hopeful, then we're looking at clinical trials early next year. But it does take time, and for us, the most important thing is to make a safe and effective product.
Julian, the sorts of things that you're looking at, would that include, for instance, the use of PPE?
Yeah, so there's an established group called the Infection Control Expert Group, which is a national group that looks particularly at infection control, including PPE. We work closely with that group on areas that are at the intersection. So, for example, recently we've been working on the clinical guidance for resuscitation. So if someone had a heart attack and a cardiac arrest, how should people respond in an area where they need to protect themselves, but also move very quickly to provide care for that person as quickly as possible?
Is there much research around the world into that sort of thing and health workers interacting with COVID patients?
Yeah, I think what's extraordinary in COVID-19 is that actually the global research community has responded incredibly quickly. So to date, over 15,000 studies have been published related to COVID-19, and we predict that by the end of the year there'll be 35,000 studies published. This is a volume of research that is unprecedented. And so you can imagine it's absolutely not feasible for a busy clinician to keep up to date with all that research, and that's what our teams are doing and our guideline panels. They do all the hard work of searching and summarising all that evidence and really thinking very carefully, what does that mean in the Australian context for care of people with COVID-19? And as I mentioned earlier, one of the critical elements of this is that across the country, we have a single voice. Talking to colleagues elsewhere in the world, they feel their response is really hampered by the fact that they have multiple organisations putting out different pieces of guidance, conflicting messages that really confuse and lead to increased anxiety amongst clinicians because of that confusion. So I think we can be proud that here, led from Victoria and here in Australia, we've taken a very different approach, and we have very clear and consistent guidelines for Australia's health workers.
Has Victoria's second wave, as tragic and awful as it's been, provided you with an opportunity though? I mean, you've got research, I imagine, underway here in Victoria. Has it given you a whole new cohort of information that you didn't have before?
So the task force itself doesn't do research. We will look at research that anyone else has produced.
I'm sure there's Victorian bodies that are doing research into COVID patients now here in Victoria.
We've always taken the approach of preparedness. So even as the first wave was decreasing, we did not stop. We were working just as hard to make sure that our guidelines were as up to date with global research as possible, in preparedness for potential increase in case numbers again, because we're aware that that was, of course, a possibility.
Based on all your analysis from research that's been done around the world, is there anything that Victoria can do better?
Look, I think that there's been a lot of controversy about different elements of treatment and care. Again, one of the things I think we can be proud of here in Australia and Victoria is that we haven't jumped onto the latest bandwagon because of a particular trend on social media. We've taken a very considered approach to that. And so in the end, what that has meant is that Victorians and Australians have not been exposed to the potential harms or side effects of treatments that are not got a robust evidence base or not proven. I think in any response, any pandemic response, of course, there's always things that you can think about that we could do better. But I think just to note that the care that is being provided for people with COVID-19 in Australia, I think, is absolutely world class.
What are some of the biggest changes you would say from the start of the pandemic, what we know about the virus and how it's treated, and now? What have we sort of adjusted?
It's a great question. So I think one of the things to keep in mind is that we do have effective treatments for COVID-19. I think people would be aware of a lot of the controversy around hydroxychloroquine, and we make a recommendation that hydroxychloroquine should not be used, certainly outside of a research setting, because there's now substantial information that it's not effective and it does have side effects. I think that has been a message that many people have heard and are aware of, but they may be less aware that we actually do have some effective treatments. So, for example, dexamethasone, which is a very widely available, very cheap anti-inflammatory, so it's a drug that reduces the inflammation in the body, has been shown that in people with more severe disease to reduce mortality by up to a third. That's an extraordinary benefit for a drug that we know very well, we've used for many years. It's very widely available and very cheap. So I hope that people are aware that there are effective treatments. We also have an antiviral called remdesivir, which is again given for people with more severe disease who are in hospital, and that has been shown to quicken the time to recovery. So it doesn't reduce mortality, but it enables people to recover more quickly. And we know that there is more research coming every week. We expect more data next week that we'll be incorporating into our guidelines, and of course all the subsequent weeks following that.
What about reinfection? I know there's a case in Asia this week that they said that they had first case of someone who's had it twice. Is that starting to gain some traction now in terms of research that you can get it twice?
Yeah, so just to note, the task force is very much focused on the clinical care of people with COVID-19, so not so much about transmission and prevention. But yeah, just to note, there are now actually a few reports of people who seem to have been reinfected. This is one of those situations where you can say we need to know more. So even though there are a few cases, we really need to understand how common is that actually. And particularly, what is the clinical course of someone who's reinfected? Is it that they tend to get a milder illness, because one of the concerns has been that potentially they could have a more severe illness because of the immune reaction. So there's a lot more to learn.
Has there been any info on the virus mutating?
There are different strains. So again, this is not our area. I think, do you want to respond to that question? That's perhaps more in your field.
There's definitely a presence of different strains that are circulating that people have done through genomic sequencing, yes.
What impact does that have on efforts to, I guess, the antibodies and efforts to fight the virus overall?
Yeah, and so one of the mutations that most people are most familiar with is this DDG mutation that they found in the virus. And some of the early studies that have been done is that some of those antibodies are still effective in the presence of those mutated variants. And so I think that work, you know, there's work to be done from what you understand from sequencing, and then there's work to and what's circulating in the population, and then work that's to be done to show whether or not that virus actually, with that variant, actually transmits more effectively or not, and that work is currently ongoing.
Is there any evidence to suggest that there's a strain that's harder or more infectious than others, or they're all roughly the same in that sense?
I think the work is still coming on that, and so I think that that's something that people have an absolutely avid eye on, is what is actually circulating in the population. Do we need to be worried about it? But I think there's work to be done from what you see circulating in the population to actually what's the virus is actually doing. And so my feeling is that there's actually a lot more research to be done in terms of how infectious it is. Does it transmit more? And is it actually more pathogenic as a variant that's circulating?
Can you see any differences between the virus that's circulating currently in Victoria and what was happening back in the first wave?
Back in the first wave? Yeah, I'm not able to comment on that, I think.
If your trial is successful and you're able to use it to give to people, it seems like the settings like aged care, for instance, might be very appropriate for your antiviral medication. Would that be fair enough?
That's, yeah. So I think it would be useful also in patients who are immunocompromised, because they would not be able to actually mount a robust immune response upon delivery of a immunization through a vaccine. And so those would be the populations that we would be looking at as well. And also populations that we can protect for a period of time prior to an outbreak. So when you deliver antibody-based therapies with the design of the antibodies, in many cases those therapies can last for weeks or months, and so that's the kind of settings that you'll be looking forward to prior to an outbreak in elderly populations and also in populations of immunocompromised patients. Thank you.
Thank you.
Well, I thought I'd try. Thank you both, professors. Do you have any other questions?
Have you offered to the crossbenchers some sort of compromise in terms of going back to Parliament once a month, for instance, to get the state of emergency?
No, we're just working through a whole range of different issues, and we'll do that in the usual respectful way. We always engage meaningfully with those crossbench members, and it's very important to do that, whether it be on this measure or any other measure where we need support.
Talked about business before. Have you thought about what stage 3 will look like?
It's a bit early for us to provide a definitive roadmap or a pathway in relation to what stages 3 and 2 will look like, but as soon as we can do that, I want to make it very clear to every worker, to every business, to every investor across the state. These rules won't be in place a moment longer than they need to be. We will, at the appropriate time, as soon as we can, try and map out as best we can a plan for very significant effort on the part of the government to underpin the considerable efforts that the private sector are making and will certainly make on the other side of this, to make sure that we've got jobs and skills and that we've got the strength back into the Victorian economy that we are very well known for, and that is so important not just for us but indeed for the entire nation. I wish I could provide you with a series of absolutely definitive dates and trigger points, if you like. That's not the nature of this thing. That's one of the most frustrating elements of this fight. But we've got to keep these numbers coming down, which means we have to keep doing all the things we've been doing, following those rules, as challenging as that is, not letting our fatigue get the better of us. And then there'll be a time for us to outline a comprehensive plan for investment, for jobs, for skills, and to make sure that Victoria can be strong again and play a massive part in the economic success of our nation.
Premier, the 12-month timeline on the proposed state of emergency powers, was that a direction of the executive, or is it based on other sort of advice, other evidence, scientific advice, medical advice?
Oh,
where did the 12 months come from?
The proposals that have been put forward are supported by the public health team, they're supported by experts, and when you think about it, that's not a surprising thing. This is not the notion that there will be rules in 12 months. It's simply the ability to make rules, the legal authority to make rules, based on advice, based on a proportional response to whatever the challenge is. We can't have a situation where we go from stage 4 to stage 1 or stage 0, basically, oh, well, we all want it to be over, so let's just pretend that it is. We can't do that. So there has to, and the other thing too, Noel, I'd just say, if you want to try and, perhaps this is the best way to make the point. If you want to say to business, here's a 6-month or a 12-month plan to rebuild, to open up, to recover, to repair the damage that's been done by this global pandemic, then I need to have some certainty that the plan that I'm putting forward has got the legal authority that it needs. Therefore, some sort of week-by-week thing or month-by-month just doesn't really work. Again, I want to stress though, no rules will be in place for a moment longer than they need to be. And this is about opening up. This is about less rules. This is about finding COVID normal, not stage 4 continuing for a moment longer than it needs to. I know it's very frustrating that we can't provide people with absolutely definitive dates, but that is the nature of this thing. That is the nature of the wildly infectious, wicked enemy that we are up against. But without that legal certainty, it's in a very practical way, it gets really hard to plan, okay, well, what does stage 3 look like? Following that, what would stage 2 look like? How would we get back to something very close to normal, but it will have to be that COVID normal.
But 12 months, did it originate with the public health team? Did it originate around the crisis cabinet table? Did it originate with yourself? Where did that 12
well,
months
it's a proposal that I've announced as the Premier. It is supported by public health advice, and it'll be before the Parliament next week. So then we can have the outcome of that process. But don't be in any doubt, we are about having the legal certainty we need to chart a course towards opening up more jobs, more movement, more activity. None of that can happen though if there's legal uncertainty. The other thing too, I hope there's a vaccine within 12 months. I hope there's a vaccine much sooner than that. I hope that some of these antibody therapies are going to be much more successful. All of those things. But you can't predicate your response on that. You've got to assume, you've got to take that abundance of caution approach and assume that this in one form or another, and therefore a set of rules will be needed for the medium and the long term. Again, not stage 4, but a stage 2, stage 1, whatever it might look like, as we wind back the sort of movement restrictions that have been critical to this point in driving down numbers, and which then allows us to open things up again. It's nothing more complicated than that.
So is it based on the likelihood of a vaccine emerging in a certain period of time? Everybody wants to know why 12 months.
Well, I couldn't rule out that at the end of 12 months you wouldn't still need some rules. But again, that's not designed to frighten people. That's just a statement of fact. I'll try and be as frank as I can, and I can't control how people then cover that. I can't control how that then is presented. But yesterday, the day before, I was very clear. The notion that in 6 months' time, even if a vaccine turned up next week, you've got to manufacture it, you've got to administer it. We don't know what the life cycle of that is, what's the efficacy, what's the utility of that vaccine. Can everyone in the community take the actual vaccine? There will be some rules in place, and hopefully they're very light touch. They're big crowds, thousands of people, things along those lines. But the easiest example and the best example is I can never see a time when someone who gets this won't be required to moderate their own personal behaviour, whether that be to stay at home for 14 days and away from other people, or to stay at home for a shorter period of time. There will be, for the foreseeable future, there will be limitations on people who've got this. We'll support them, of course. We know that isn't easy, but that's probably the best example. Just think about it for a moment. Righto, we get numbers down to a number that we think we can keep an absolute lid on. We want to start opening up. If we haven't got the legal authority to be able to say to someone who's positive, righto, you've got to stay at home for 14 days, but we just ignore that fact, we open up, businesses start to employ again, people start to go moving around the community again, we get the inevitable extra cases, we get the outbreaks, and we've got no confidence at all other than a handshake, not that you can handshake, you know, the kind of honesty policy, oh yes, everyone will stay home when they should. Imagine, we all know where that leads. That will lead to, rather than businesses recovering and opening up, workers getting back to work, families having that sense of financial security, we'll just be essentially, I think, beginning a third wave. That is not what we want to do. We want to make sure that we can provide as many people with as clear a plan as possible. And if there's not some legal authority to underpin that, well then you wouldn't be giving people certainty. You'd be in fact doing quite the opposite.
But almost all sides of politics agree the need for restrictions will be ongoing. They question the lack of oversight.
Well, that's entirely a matter for them, and there'll be a debate. There'll be a debate in the Parliament. But as I said, I'm not here to conduct negotiations with the crossbench today, with the greatest of respect to all of you. I don't think that would be an appropriate way to go, nor am I here to go to provide a detailed progress report. I just wanted to reassure you, and through you, the Victorian community, that as always, we are deeply engaged in constructive and positive discussions with the crossbench, and I'm very hopeful that we'll get an outcome that allows us to keep driving these numbers down, to then open up the economy, and to make sure that we are exclusively focused on jobs, skills, strength, and repairing the damage that's been done to our economy and to communities. I'm very, very positive about that. Sorry?
It's hard to imagine you as opposition leader ever supporting legislation like this.
Well, again, you can run opinions on what I may or may not have done 6 years ago. Ultimately, we're not 6 years ago. This is a 1 in 100 year event. I make no comment on what you know. That seems a long time ago. 6 days ago seems a long time ago. These are unprecedented times, and we fully understand that we've had to make some decisions that have been very painful, that have caused great harm. But at the same time, to let this thing run wild, I just want to make a point that I've not made for quite some time because it wasn't particularly relevant. But there are some in the community who don't think this is real. There are some in the community who thinks, oh well, just let it rip. It'll be fine. I'm fit. I'm young. I'm healthy. Well, the problem with the hospital system being overrun is that it's not just overrun and struggling to provide care and support to COVID-19 patients. Every stroke, every motor vehicle accident, every heart attack, every cancer surgery, every single thing we need that is in any way time critical, that gets overrun also. So we just need to remember, that whilst we've had to make many decisions that are very painful, the alternative, we see in other parts of the world just how tragic it is, and that's not to in any way take attention away from the great hardship in the Victorian community. We will do the work to repair that damage. We'll all work very hard to do that, but the alternative is not something that any of us could ever settle for. It's not hundreds of deaths, it's many, many thousands. And it isn't just COVID-19. It finishes up debilitating and ultimately undermining all of your healthcare system for everyone who needs it. And on any given day, there are hundreds of people who need that sort of care they just wouldn't be able to get if we were to listen to some of the conspiracy theories and if we were to listen to some of the people who are out there almost inviting people to not follow rules. That's in no one's interest.
The Prime Minister said this morning that he had raised...
Did he say it in stereo?
Almost. The Prime Minister said this morning he'd raised concerns about the extension of emergency powers with you, in part, it seems, based on calls to his own office.
Sure.
Can you say the nature of those concerns?
Oh, we talk often. We send messages to each other often. As he said today, we don't necessarily agree on every matter, but we're working very closely together. He doesn't he doesn't have to deal with these sorts of issues, and there are a whole lot of things that are on his plate that I don't have to deal with. Public health and wellbeing is an act of the Victorian Parliament, and I'm confident through the constructive dialogue we're having with the crossbench we will be able to make amendments to that act next week. That'll mean we can keep people safe, and this is the key point: open up. That's what the amendments are about. The amendments are about a framework and certainty in the weeks and months ahead to open Victoria up again and to create jobs and prosperity and repair the damage that this pandemic has done to all of us. That's what these amendments are all about, and I'm confident that we'll get a good outcome that serves both of those purposes.
So did you think that maybe a 6-month extension might have sent the wrong message, giving people false hope that this is all going to be over in 6 months?
Oh look, no, I'm not going to be a commentator on myself. We've put forward what we believe is a good and common sense proposal to the Parliament. We are engaging with the crossbench. I'm grateful to them for the constructive way in which we're doing that, and we'll see where the parliamentary process gets us. But I'm very confident that we will be able to have a framework that not only controls this virus and keeps it at very, very low levels that we can be confident we can contain, at the same time a legal framework that allows us to back business, to back jobs, to support that repair, all of that important work. It's so important that we get on and give to industry, whether it be peak bodies, large businesses, the smallest of businesses, the certainty to know that here is a set of rules, and if we all play our part, if we all do what we have to do, then we will be able to have a set of rules and a recovery strategy, not for a week or two, but for months and years. The opening up process and the repair work will not be quick. It will take time. And that's why we have to provide, particularly in uncertain circumstances, as much legal certainty as we can. But again, no rule will be on for a moment longer than it needs to be. They'll be there to facilitate opening up, to facilitate and to underpin and make possible recovery, jobs and a sense of security in the future, and of course to make sure that this virus, once we've defeated this second wave, we're going to make sure that we keep it there at those very, very low levels. That's why I'm so proud and so grateful to every Victorian who's following the rules. It's a deeply impressive thing. Together with all of our experts, it's a massive team working so hard. These are not easy times. No one for a moment is saying that. And I think we can be positive and hopeful about what the next chapter will be. But we've just got to stay the course and get there.
So you mentioned you can't tell us what stage 3 will look like.
I wish I could give you a definitive date and a list of what stage 3 would be, but that would be to say that we wouldn't look at what was happening in terms of the data, the science, the evidence, and you've always got to be guided by that.
Of course, that September 13 date is though fast approaching. It's only 2.5 weeks away.
Indeed.
And it takes time for businesses to
It
ramp
does.
back up. Do you know when businesses will have a date, or will it be September 10 or?
Well, we'll endeavour to give people as much notice as we possibly can about what the next stage looks like. But I would just say that we're not going from stage 4 to stage 1. We're not going from stage 4 rules to no rules. It'll have to be a graduated, cautious process because even at very low levels, the notion of just claiming victory and opening everything up again, well, those case numbers won't stay low for very long. So we're going to have to ease out of this gradually. But again, I think that won't be easy, but I think people can plan for that if they've got a sense that, okay, well, here is a strategy, many months. Here's what 21 looks like, the whole year. That's why we've asked for an extension, to give us that certainty. Not to impose rules that don't need imposing, but to give people certainty about what the path back to COVID normal in the first instance, and then just normal after that. We want to give people a plan, a long-term plan. Now, there'll be lots of caveats on that because this thing's wildly infectious, it's novel, it's challenging, very challenging. But I think in these times, the more certainty that you can give to people, whether it be workers, families, businesses, investors, the more certainty you can give in uncertain times, the better. That's the logic that's driven us, and that's the basis on which I think by working very productively and closely with the crossbench, I think we'll get an outcome that serves both public health but also allows us to open up and to back business to do what they do best, and that's create jobs, create the sort of prosperity that this state, this proud state, is well known for.
And what would you like to say to business owners then? What should they do over the next 2.5 weeks? They just relax and just wait?
No, I don't think anybody's relaxed. I think this is a very challenging time. But people know and understand that we've set stage 4 for a period of time. That's how long we think we need to get these numbers down. I can't be definitive about that. The numbers will guide us. This is the whole thing. And I would again just say to you and to every single Victorian, everything that can be done is being done. Every effort is being made to get these numbers down. I will just, again, to circle back to the key point in many respects today, apart from the very, very impressive work that so many of our researchers and other scientists are doing. If you've got symptoms, even very, very mild symptoms, as soon as the scratchy throat starts, the runny nose, the fatigue, the headache, the fever, you've got to go and get tested, because that is so important. We want the test numbers, as many people as possible, to come forward and get tested if they've got symptoms, so that we've then got our dedicated experts have got the most complete picture of how much virus is out there, how big a challenge is it, exactly how successful has the strategy been, and are we confident, this is the key point in many ways, are we confident, because we've done enough testing to get a big enough picture, a clear enough picture, are we confident that we'd be able to keep it suppressed at very low levels? That's when you can at that stage say, right, this strategy's worked, we have defeated the second wave, but that shouldn't be just the beginnings of a third wave. That should be the beginnings of a long-term, clear plan and strategy with the appropriate legal authority to make it work, to open up, to find that COVID normal, and hopefully along that time, amazing people working so hard across the world have been able, including right here, have been able to develop a vaccine or other treatments, and then that's the kind of game changer that we're all hopeful for.
Are you waiting till the passage of this legislation before announcing what happens after September 13th?
Well, you can't separate what happens after the 13th of September in terms of the 6 months basically expires then. So you can't separate the two issues. But I would just say, lest anyone thought that we were trying to conflate things that shouldn't be linked, it's too early. It'll be too early next week for us with any certainty to be talking about what things look like after the 13th. We get this data every single day. We've got to analyse it. No one day is really key. You've got to look at trends over weeks, multiple days, and then make the best guess about what's out there still. And you can take a lot of that guesswork out by having the testing numbers up. So I'd be grateful to all of you if you, in your coverage, if you can just again remind people that it is a really powerful thing that they can do, a really powerful thing they can do, a massive contribution they can make to our shared fight against this enemy. Any symptoms, even the mildest of symptoms, as soon as you start to feel those symptoms, come forward, get tested. That makes a huge difference.
On testing, Ballarat Health is running a program to get more people under 30 to get tested.
Yes.
Yesterday's figures showed about a third of new cases were people 20 to 30.
Yes.
How concerned are you about that?
Oh, look, we're concerned about any positive case, but there is a trend here, and that's not surprising in some ways, because people of working age, for instance, will be people who in permitted industries are still going to work. They're the ones who might go out to the shop. They're the ones who might be out and about and perhaps most exposed to some of the community transmission, those mystery cases that we've seen. But the key point here, though, is everyone, regardless of age, background, gender, postcode, this thing doesn't discriminate, and none of us have the luxury of being able to make the choice, oh, well, I don't feel very well, but I won't go and get tested. It's really important that people come forward and get tested. So we've got the most complete picture of what's out there. What are we up against? How big's that where is the enemy, and how big a challenge do we face? And this is a game of, in many respects, trying to not just drive down case numbers, but drive down the amount of unknowns. Put as much certainty into this as possible. That's part of our public health response. It's also got to be part of our economic response, which is why legal certainty through the Parliament, not to apply rules that don't need applying, but to apply the things that facilitate and make possible opening up, investment, employment, recovery. That's why we're asking for these things, and that's why they're so important.
Those test numbers have been lowish for a couple of days. How worried should we be about that?
It's not about worry. It's just about, I think, just reconfirming for every single Victorian, and making an appeal to every single Victorian who's got symptoms, even mild symptoms. And, you know, at the risk of saying it literally 1,000 times a morning, I'll keep doing it because it's so important. It's so important. If you've got any symptoms whatsoever, please come forward. There's more than 190 sites right across the state. We are seeing, and I haven't just got this from a brief that's been provided to me, although we can have confidence in those too, but I've got it firsthand from people. Lots of different people contacting me and saying, I got my test results in a day. I got my test results in less than 1 day. So that the labs are really doing an amazing job at the moment. So that shouldn't be a disincentive for anybody. It's a big thing, a big and powerful contribution that you can make. It's worth a fortune. It's worth a fortune to all of us. If you can come, get tested, go down, get the test taken, get your result quickly, stay at home until you get the result. That gives us the most complete picture, and that allows us not just to continue to drive case numbers down, but it allows us to open up. And that's what everybody wants.
WorkSafe's confirmed it's looking into Department of Health, Department of Jobs and security companies working on hotel quarantine. Will that clash with the inquiry? Are they able to work in conjunction with the inquiry as it runs?
You'd need to speak to WorkSafe about what, if any, arrangements they're going to put in place to do their job in what is a pretty context-rich environment. Like, it's complicated, but I'm sure they can work through that.
Do you know how many high-risk environments they have to inspect at the moment while they're doing their work?
I'll tell you what I'll do, I'll get an update for you tomorrow. I did one 4 or 5 days ago. The number of, I think it was 4 or 5 days ago. Might have been longer, might have been less. Time is strange at the moment. What I can say, though, is that there are literally hundreds of inspectors out there and they're visiting hundreds of different workplaces. Again, this gets back to the central point. Those work cover inspectors are going and making sure that businesses are doing the right thing against their COVID-safe plan. Not their voluntary COVID-safe plan, their legally required COVID-safe plan, which is a function of directions made by the Chief Health Officer, and exactly why we need that legal certainty beyond the 13th of next month. So I'll get you an update. We'll go through, if we can give you a bit of an industry breakdown as well. They do some of their checking is done virtually, so they can have an online discussion and people go through a checklist. Then they follow it up with visits. They've done a lot of visits. And there have been some penalties issued, but I think by and large people are doing the right thing. And again, I'm not here to make a commentary on any particular industry, but I just think logic tells you if a business is doing, if it's a voluntary code, which is what it would be if we don't extend these arrangements, then I just think you'll see less people doing the right thing. As it is now, there are very significant penalties. People are taking this very seriously. I'm grateful to them. I'll come back tomorrow with some updates in terms of some of the enforcement work that they're doing. And I think, look, some of the outbreaks we've seen and not seen compared to earlier on in the second wave, that shows you limiting movement, better safety procedures. You know, I don't think any of us thought we'd see people in abattoirs working in PPE that wasn't too far away from what a hospital worker wears. But that's what we have to do. That's the enemy that we're up against. You certainly can.
Questions?
Just on workplaces, we seem to be having fewer outbreaks in workplaces. Are you confident we've seen the worst of that pass now?
I think it's certainly improving day by day. We're seeing fewer total outbreak numbers each day in terms of new outbreaks, but outbreaks still make up 30 or 40% of our cases every day in terms of being linked to outbreaks, but that includes aged care and healthcare settings as well. There's probably another 40% that are the close contacts of known positive cases, and the remaining 20 or fewer percent are those mystery cases or cases still under investigation. So outbreaks still are not insignificant, but I think the workplace outside of healthcare are a smaller and smaller proportion of those because of all of the things that have been planned for and the real focus on prevention and preparation, and the COVID safe directions are certainly part and parcel of that.
In the overall trend, do you see today's numbers fitting in where you wanted them to be?
Oh, they're a bit stubborn, but 3 days under 150 is not bad, and I think they'll continue on their downward trend. But we've said before, a single day or a few days even is not the whole picture. The 7-day average is continuing to come down, and I think it'll carry on into next week and beyond. We know that the restrictions that are in place put that downward pressure on transmission, and so that will show in the numbers over time.
Professor Sutton, last time when we entered into stage 3, the numbers slowly crept up to the point where it reached, close to 700 odd. When we return to stage 3 next time, what are some of the key things you learned from the previous stage 3 that you think we should do differently this time?
Well, I think we obviously have to get down to very low numbers to be confident that they'll be under control. They'll be under control by virtue of whatever restrictions that we have in place coming out of stage 4, but they'll also be under control in terms of the turnaround time for testing, the follow-up for every case and every close contact. So all of those processes need to be as robust as possible, and we'll need the testing numbers to continue. I think it's testament to New Zealand that, having gone 102 days without a single case, that people were still presenting with cold symptoms for coronavirus testing. They wouldn't have found a significant cluster if people still didn't have it in their minds that with even mild illness that they should come forward for testing. And so that'll be an absolute pillar that will continue to push right through beyond stage 4.
Given the level of lockdown we're in now, I guess some people are sort of wondering how people get infected under this environment in the first place. Can you shed a bit of light on, is it coming from workplaces or is it sort of surfaces, or I guess if you knew that?
Look, transmission is still close contact with other individuals. It's still that distance of less than 1.5 metres, and it's probably when people have their guard down. Certainly there's transmission as people might pick it up at work and take it back to their families, but we know that people also have to separate from their families. If they are a close contact and they need to go into quarantine, they need to try and minimise the contact with the rest of their family to the extent possible. And again, we would support that in whatever way that we can, if we can offer up a hotel space for people who need to quarantine because they're in a big household or they're normally in close contact with a number of others. We don't want to see that continued spillover into close contacts. But in the workplace, there are some workplaces where close contact is really part and parcel of your work, and that's obviously where we're using PPE and making sure that people are never coming to work symptomatic. That's an ongoing battle for us. People will still turn up to work with very mild symptoms because they are dismissing it as potentially coronavirus. So everyone needs to work on the assumption that it's coronavirus until proven otherwise, and it's only proven otherwise when you get that test and that negative result, and you still stay away from work until you're well. So that has to happen. But the transmissions might happen in workplaces when people have their guard down. That might mean that they don't always have their mask on, they don't always keep that 1.5 metre distance, or that they might see someone socially as they step out of work, on the way home. People need to be mindful of this all of the time. It's hard work, there's no question that sustaining these behaviours are really tricky and they're burdensome for people, but that's where transmission's occurring. Those sometimes brief encounters that are close, droplet spread, because it's coughs and sneezes that'll transmit this virus.
Just on after September 13, I'm sure I speak for everyone when I say this has been the longest 3.5 weeks of my life. And that comes after, obviously, we spent a few weeks in stage 3. Is there any sense of hope that we might be able to do a little bit more, even in terms of seeing loved ones and friends outside, even in stage 3 after September 13 than we were beforehand?
Of course, we're wanting to look at that. We understand the significant pain and strain that it means for people. We do have to review right through the next couple of weeks where transmission's occurring and what it'll mean. What are the lowest risk settings? What are the lowest risk interactions that can be part of that lifting of restrictions? And that'll come out through our review of the data and each and every case. As we get lower and lower numbers, we'll get a richer picture there. because we'll understand the very specific settings where that transmission might be occurring. But of course, we have to be mindful of how significant a psychological burden it is for people on mental illness, on domestic violence, and on access to healthcare. We don't want anyone not to access healthcare. That's part of our encouragement to say, yes, these restrictions are in place, but there are absolute exemptions from staying at home, which includes getting a test, seeing anyone for health purposes or emergency purposes. That should absolutely continue, and I want to emphasise that.
Yesterday, the Prime Minister said Victoria's testing, tracing and quarantine arrangements had proven to be unacceptable. As someone who works in the health department, what did you make of those comments from the Prime Minister?
I don't comment on political statements. I haven't heard it directly. I wouldn't provide comment. I know that the team has worked tirelessly for 7 months, that we've gotten through the entire first wave to a point where we drove cases down on days to zero. It's been successful in that regard. We've been challenged by a second wave that is not unique to Victoria. That's exactly what Europe is about to step into over summer, with 500 million people who are going to be struggling against a really significant wave, with already some of those countries with thousands upon thousands of cases per day. Victoria looks pretty good against some of those jurisdictions. I wouldn't ever say we should sit back on our laurels about where we're at and what we need to do going forward. But we've been pretty successful in relative terms for something that is globally extremely challenging.
Last question, please.
Did you ever get around to testing wastewater? You've talked about it before, and they've started doing it in Albury. Are we doing it in Victoria?
Yeah, we're doing it across Victoria. There are samples being taken in wastewater for sewage surveillance purposes. I think we've said previously, now is not the time to really get data from it in terms of informing actions, because we're making the assumption that we've got transmission, across Metro Melbourne and in much of regional Victoria. It'll be most useful when we've got very low case numbers, where we kind of want proof of absence of virus, especially in regional areas. When we stop seeing cases there, which we will in the next couple of weeks for a lot of local government areas. We're now up to dozens and dozens that have no active cases. That will be an opportunity to test sewage, look at that wastewater, and if we've got a sensitive enough test, to be happy that if it's negative, then everyone within that sewage catchment is free of virus. So that'll be an opportunity for us to really check that our surveillance is going through both a clinical surveillance of cases, but also that wastewater to be an extra check that there are no cases out there. And maybe if we detect virus, that's the prompt for us to say, look, we know there's an active case in this community. It hasn't been notified, no one's tested positive. Here's a prompt for testing within that town or region because there's a case there, and they need to be mindful of the fact that everyone should come forward for testing so we can identify that individual and follow their close contacts as we would normally.
Just on testing, are there certain suburbs or areas that you're worried about where the testing numbers are low, that there might be undetected virus there?
Certainly for regional Victoria, we're above the WHO standard for numbers of tests for every detected case. We're well above, so that's great, but it needs to be maintained. In Metro Melbourne, almost all LGAs are at a very good testing level. We do want to marry up the areas where the greatest transmission is occurring with the most testing. We can probably do better in that regard, but part of our dashboard now with publication of new exposure sites is also meant to be a prompt for people to get testing in some of those areas. So I expect that will lead to an uplift in testing in some of those areas. But we're always reviewing it. I couldn't tell you any particular LGAs at the moment that come to mind, but can come back to you on it as well.
Has there been a uniform drop in the testing numbers, or is it certain spots have dropped more than others?
Oh no, it's pretty consistent. Obviously, if there are new outbreaks, if they have some prominence, then testing can pick up. But you know, it's really been only the last few days that we've seen test numbers go below 20,000. Pretty ordinary weather, so it's not entirely unexpected, but we do want that very broad encouragement for people to come forward for testing. The transmission areas are still, you know, Wyndham, Brimbank, you know, in the north and west of Melbourne. So those are areas where people should especially be mindful of getting tested, but it's certainly the case that across the state, anyone with compatible symptoms should come forward for testing. Thank you.
Any other issues? If not, thank you, and we will see you tomorrow. And thanks to Julian and Wei. Thank you.